Hi, I'm Jim. I'm 69 years old, retired Army officer, and have a lot of problems with osteoarthritis. But I came to, at the time, advanced therapy by recommendation about a little over a year ago, a year and a half ago. I was at Dothan getting some orthopedic shoes because I have type 2 diabetes. And lady there recommended Mark and advanced therapy because she knew it was a good physical therapy place. I had tried another therapy place here in Dothan and wasn't particularly satisfied, and voiced my need for a good physical therapy place. Now my background is I have had bilateral knee surgery, both knees replaced. I've had 2 lower back surgeries, lower lumbar, and fusion of C4 and C5 in my neck because of bone spurs from the arthritis. And what had happened over time is I just couldn't walk very well. I had a lot of trouble walking. I had a bad bone spur on my heel, caused me to walk with, I just couldn't walk very far. And the orthotics didn't help that much. So when I came and met with Mark and his staff, and he evaluated and looked at the way that I walked, he said, "You got a real problem." I said, "Well, I knew I had a problem, but I got rid of the heel problem, but it caused a lot of other problems. I didn't have to have surgery, but over time, and it took about a year of therapy, physical therapy. We went through about 8 months worth of physical therapy, a couple days a week, 3 times a week, in a progressive manner, changing my walking habits, doing things like I found out I had drop foot, which was I had both knees replaced earlier and didn't have it initially, but after 8 years, I started dragging my toe a bit. The brace came from Dothan Brace Shop, that helped, but the exercises and the therapy helped a lot. It changed my gait. I was able to get on the treadmill and do a lot of things. Up until then, I had trouble walking more than 100 yards without severe pain in my back. And I still have a lot of problems with my neck. They're due to bone spurs. There's not much we can do about that but work around it. But I found a lot of different ways. Even the surgeons are not recommending a whole lot more surgery. I don't want surgery. The last surgery on my neck caused a lot of other problems with my hands, and my bicep doesn't work anymore. But we found ways around it. I actually can use more of my muscles now than I could a year ago. I've got a lot more strength in my hands and my arm than I had when I started here a year and a half ago. And actually, after 8 months, we thought I would need to go back for more therapy, but I haven't. I'm now in the wellness program and have been since the first of this year. And we periodically thought I might have to go back, but so far, I really haven't needed the therapy because so far the wellness coming twice a week is adequate to keep me going. And so far so good. So when the need occurs, and I'm sure with the osteoarthritis it's a progressive thing, that it's going to get worse at times. So, and I trust the folks. The staff here is exceptional, and I can say that I have a qualified opinion because for 20 years I've been fighting this. I put my knees off for 11 years at 50 when I had my first knee scoped, tore it up in high school, and got through it. And in fact, the old team doctor said if I would let it heal naturally instead of having it fixed so I could keep playing football, I'd come back and thank him when I turned 40, and I did. And I was able to join the Army, went through Ranger School with no problems. I did have a big knot on my knee, but it was on the outside. But I tore the medial collateral. They called it the big tendon on the inside back then. But over time and with arthritis progression, it got a lot worse. But with a lot of physical therapy, but I wasn't in Dothan, I was in Huntsville. And Huntsville, Alabama has a lot of very, very good therapists. And so I went through a lot of therapy with that. My lower back went out when I turned 50. And we put that off for a lot of years until I had some surgery on my lower lumbar, orthoscopic surgery, not any fusions. The fusion occurred in my neck. But I knew what good therapy was, and when I got here, the first try was not good. When I got to Mark's place, I found out it was comparable to the best that I had in Huntsville. So now Legacy is highly recommended. My experience has been great, and now my wife is coming. She finally got here, and she's got big troubles with arthritis as well. And we're sold on not just Mark, because Mark is great, but he's got a great staff as well. So this is a good place, and I highly recommend it.